All right. Hello, everyone. Happy Thursday. We have the pleasure today to welcome again Dr. Hollmig to share with us a topic that is on, many people's minds. So, Dr. Hollmig, happy Thursday. Thank you for joining us again.
Oh, thanks, Ming. It is a pleasure and an honor, as usual. And this is one of my favorite topics. So I'm really excited to be back discussing skin aging.
Awesome. So, as everyone knows, Dr. Hollmig is a board certified aesthetic dermatologist. He graduated at the top of his class from Stanford and other great universities and training centers. Tell us a little bit, Dr. Hollmig, what is the difference between an aesthetic dermatologist and a regular dermatologist?
Ming, you're making me blush with all these compliments. So, in become a dermatologist, one has to go to college and then medical school, of course, and then do a residency in dermatology. And in a residency in dermatology, we learn all about the skin and what healthy skin looks like and what diseased skin looks like. And there is some incorporation of aesthetic education in residency as well, although usually not just a ton of aesthetic education. And so some of us go on and do a fellowship. And when I finished up at Stanford, I did a fellowship in surgical dermatology, which includes skin cancer removal and reconstruction, and then lots of techniques, including lasers and other devices and other techniques to improve skin health and beauty as well. So it entails extra training in that respect. And then, on top of that, where I think I really truly learned quite a bit about the skin and skin beauty was I returned to Stanford after fellowship and was on faculty there for 5 years and directed all the laser and aesthetic dermatology. And it's really seeing thousands and thousands of patients and treating them along with doing quite a bit of research. So at Stanford, we really had wonderful translational and basic science research where we could hone in on things like skin aging. And so it was just an ideal opportunity for me to learn and grow and expand, and been able to take that knowledge and those experiences with me here to Austin, where I'm at the University of Texas and direct all of dermatologic surgery. So this is really my focus is aesthetics alongside with skin cancer in reconstruction surgically, which I enjoy as well.
That's amazing. And Dr. Hollmig, what would you say, about the patients that you see? About what percent of them are concerned about anti-aging related concerns?
I would say the vast majority of us are on some level or another. I love my practice because it has a lot of breadth. So I'll treat some children with genetic disorders or other birthmarks that require laser treatment. And then I treat all the way up through elderly patients, typically with skin cancer. And I would say everyone, even including a lot of those veterans who come over to me for skin cancer surgery from the VA, are concerned with aesthetics. When we remove a large skin cancer, we really try to rebuild things beautifully and perfectly, because how we meet the world is through our skin and particularly through our face. That's really our focus. So I think it matters to a lot of people. And I think from a societal perspective, really there's been a shift toward a focus on longevity and healthy living, and the skin's appearance really ties into that. So, I think my practice is probably I see a very large number of both aesthetic patients as well as skin cancer patients, but everyone is concerned about aesthetics on some level or another.
Absolutely. And Dr. Hollmig, how related is skin health with the aesthetics of our skin?
Well, I think it should really encompass just about all of our focus on aesthetics. There are some folks historically who focus just on, I want to do whatever I can to make the skin look great, and that is when we start seeing things that look maybe a little bit silly, like movie stars who maybe have a little bit of too much work done, or thinking about kind of the look in the 80s of just very grossly enlarged lips and things like that. So if the focus is just on appearance, we can sometimes get off track. To
Mhm.
me, beautiful skin is healthy skin. So anything that we can do to reduce what we know about aging, anything we can do to make our skin truly healthier, to have plenty of collagen, to not have overstimulation of melanocytes, which give our skin color and are associated with an aged appearance as well. Anything we can do in those sectors, I think, make us look most beautiful. I think we look our best after a weekend at the spa, a good night's sleep, something along those lines. That to me is my goal with my patients, is to provide them really healthy skin, because I truly think that healthy skin is beautiful skin.
And that's such a great point and a great segue to our next topic. Dr. Hollmig, I know that you have a very well-developed and in-depth talk on aging itself. So why don't you take us through that talk? I feel really lucky that we get to hear it, because usually it's just reserved for, your fellow colleagues at, dermatologist conferences. So please take us through that. We're really excited to hear it.
Oh, you're so nice. I would love to talk about aging. I hope I don't bore everyone to tears, but I can certainly give a general outline about how our skin changes over time. And also we can talk about how we can mitigate, and really try to reduce those changes that aren't the ones that are our favorites. So, just starting with that, it's important to know that skin has a lot of functions. In dermatology, we always brag about the skin. We get really excited about it. We tell everyone that it's the largest organ in the body, which of course it is. But it has lots of functions. It's not just a barrier. Of course, the barrier is important. It blocks, UV light. It blocks pathogens like bacteria and other things that could harm our body. But it also does other things too. It maintains our body temperature. It maintains our hydration levels. It helps us with sensation. It has lots of nerves in it. And it also helps with immunologic surveillance. It's a really critical component of our immune system. All of these facets of skin change as we age. So there's really many ways to look at skin aging. I think our focus today is really how the skin appears as it ages. And what we see over time is that the outer layer of the skin, the epidermis, which is very supple and thick in our youth, actually becomes very thin. Additionally, the dermis, which is the next layer below the epidermis, and it has the bulk of our collagen, also thins as well, because the cells in the dermis, called fibroblasts, that produce collagen, which makes our skin look great, they go into senescence. They just stop being activated. And we actually see abnormal accumulations of elastin fibers, which are fibers that help with stretch. When I look at the skin under the microscope in my skin cancer patients, when we're removing those, I use a microscope to identify where the skin cancer ends and normal skin begins. I can look at it under the microscope and tell you exactly how old a patient is and how much sun exposure and how much smoking exposure they've had, just based on what the skin looks like under the microscope. It truly changes. It thins. We develop fine lines, and we develop uneven skin tone due to activation of those melanocytes that I mentioned earlier. So those are the changes that we see. Skin aging really has two main sort of facets. One is extrinsic aging, that's aging in the skin due to our environment. And the other is intrinsic skin aging. Intrinsic skin aging is how the skin would change if we all lived in a cave, which of course is a dermatologist's dream. Intrinsic aging just sort of symbolizes that all of our organs, our internal organs and our skin, do change in age over time. So as a dermatologist, it's helpful for me to view skin aging in those two contexts, because our treatments for each of those and our understanding of each of those are really different. So with intrinsic aging, for example, we know that as we get older, we produce less collagen. Those fibroblast cells that I mentioned earlier start to reduce their capacity. And with that, we see changes in actually the DNA in our cells. Our cells turn over, and we have stem cells in our skin that turn over and produce new skin cells. And over time, our DNA frays. At the very tip of our DNA in all of our cells, including skin, there's almost like these little, the plastic things on the tip of shoelaces. They're actually called aglets, for those trivia fans out there. They keep shoelaces together and they keep them from fraying. And our DNA is the same way. As we get older, those aglets, those plastic tips, kind of break off. Those are called telomeres. And as they break off, our DNA frays. And so as our cells turn over and we make new cells in the skin and all of our organs, the cells aren't replicated as evenly. And so we start to have damaged cells and damaged skin. Extrinsic aging is totally different. Okay, that goes back to that skin protective barrier function. And there are many things that affect the skin's appearance. Things like UV exposure, cigarette smoking, alcohol consumption, lifestyle, dietary factors, and sleep all play a role in our extrinsic aging because this is how we interact with our environment. It's thought that about 2/3 of our skin aging is due to environmental exposure, at least appearance. But I will tell you that the more we investigate how the skin ages, the more we begin to understand that extrinsic aging and intrinsic aging may share similar molecular and inflammatory pathways. So, again, I don't want to bore the audience to tears, but just like everything else it seems like we learn about in science, there's much more overlap than would have been predicted initially. Okay, so let's get back to what we see clinically. How does skin aging change over time? Well, each decade comes with a gift. Sometimes these gifts are good, sometimes they're not as good. I would say starting in even the 20s, we begin to see some signs of aging in the skin. For example, in the 20s, we start to see a little bit of loss of subcutaneous tissue or baby fat in the skin. So we go from kind of looking like boys and girls to men and women with a different look, a less rounded look of the face. Additionally, changes in skin tone start to develop in the 20s as well. Melasma is incredibly common in women. Melasma is also known as the mask of pregnancy because it sometimes comes out during pregnancy, and it has hormonal factors as well as sun and other sort of vascular and other etiologies which contribute to it as well. So those are two things that we see in the 20s. We see redistribution of subcutaneous tissue in the face, which changes the shape of our faces, and then also a proclivity, a tendency for some patients, some of my patients, to develop things like melasma or uneven skin tone. As we progress into the 30s, the skin starts to produce less and less collagen. So this is when fine lines start to appear. And a lot of the patients I see will say, hey, you know, my skin used to look really bright. It used to pop and glow. And now it has kind of a matted, sort of dullish appearance. And that's due to changes in collagen production by our fibroblasts, which are reduced in our 30s. And also another activity of something called matrix metalloproteinases, which break up healthy collagen. And I'll mention those again in a minute, just because there's some evidence that our dietary factors affect that process. Late 20s and early 30s are often a time that we see fine lines sort of begin to become deeper, especially in the upper part of the face. And this is due to a lifetime of muscle activity as we squeeze those muscles, as we animate our faces, as some of us yell at our children and spouses on occasion. Those fine lines deepen due to muscular activity. So this is a time that we often add something like botulinum toxin treatments to our patients. The 40s is often the decade when fine lines first develop around the lips. And this is really unfair, but this tends to only develop in women. There's a muscle that goes around the mouth, and as it contracts, it kind of sends off vertical spokes in a wheel, and those develop wrinkles over a lifetime. So that's worsened by things like smoking. If you are a competitive whistler, for example, these might be worse than in other folks, but this is very common. These are commonly developed in the 40s. And so there are treatments for that too. And sometimes bringing in things like antioxidants and retinols in our skincare products, along with lasers and other devices, can help reduce those changes around the mouth. And then as we head into the 50s and 60s, that's really where having a good lifestyle pays off. So my patients who are in their 50s and 60s who are looking fabulous, they never smoke, and they almost always have done a good job with sun protection. There still are major changes, of course, in these decades. We start to see bony changes. So aging isn't just in the skin, it's all of our body. So bone in the mid-face, what we call the maxillary bone, starts to recede as we get older. And if you combine with that reduction in bone and a reduction in muscle, alongside a loss of skin collagen and elasticity, this is really what drives deeper wrinkles. So we have fine lines due to a lack of collagen production and deeper crevices and concavities due to these deeper changes, which are exacerbated by a continued loss of collagen. Of course, gravity's undefeated, sadly, and so over a lifetime, we start to see the skin pull down as well. As the face kind of goes from a grape to a raisin, as we lose that volume, again, deeper and deeper lines can develop. So that's kind of walking us through what happens the decades with aging and touching on molecular factors that are involved in that as well. So that's kind of the base core discussion of why aging happens. And then, Ming, if you like, I can stop there, or we can also go into kind of talking about lifestyle factors and how they affect the skin health and aging as well.
Yeah, that would be super helpful, Dr. Hollmig. Why don't we start one by one? So you mentioned how 2/3 of aging is attributable to extrinsic factors, which is on the one hand really scary. On the other, it gives us hope because that means maybe there's something we could do about it. So could you talk a bit about the different categories of extrinsic factors that really contribute to aging and what we could do about each one?
Yes, and you were exactly right. So it's concerning how much our environment ages us, but it does give us hope because so much of aging is actually preventable or at least reducible if we take simple lifestyle steps in terms of changing our lifestyle. And also if we do things like just use basic good skincare. So we'll talk about all of that. UV light has consistently been shown to be the main driver of external aging. And for a long time, this was just thought to be due to the same type of UV light that gives us sunburn, which is UVB. So when we think about the electromagnetic spectrum, you might go back to high school physics and remember some of that. There's a visible light spectrum, and then shorter wavelengths than that are called ultraviolet light. So there's UVB, which is pretty short, and then there's UVA, which sits right in between UVB and then the visible light, the light that we can see. So for a long time, our sun protection was just targeting UVB. We wanted to reduce sunburns, and UVB can drive skin cancers as well. So it's a good idea to block that. But we missed out on other spectrums of light, particularly UVA and some visible light as well. And those wavelengths have actually been shown to drive the majority of extrinsic aging. They really, really deactivate our fibroblasts. They really change the way our keratinocytes, our skin cells, replicate, and they cause things like sallow, thin, translucent skin. So UV exposure is really important. UV exposure is the main factor behind wrinkles, so-called age spots, so discoloration, things like freckles, lentigines, liver spots. All of these things can be caused by UV light, along with precancers and skin cancers as well. So UV light is really, really important. And it's important that we all are really vigilant with sun protection, whether we are outside at the beach or if we're just inside in front of a computer or inside an office where window glass permits UVA light to shine through. So UV is key. As a dermatologist, sometimes you feel like you're kind of talking about UV light over and over and over again and boring everyone, but it's for good reason. I think UV is the number one factor, but there are certainly others. Dietary factors have come to the forefront in the last couple of years, potentially playing a real role in how our skin ages. And there's not incredibly good evidence behind dietary contributions to aging, but there's better and better science here. And so I think it's worth talking about. I mean, one hot topic has been so-called advanced glycolation end products, or AGEs, also known as glycotoxins, some of those. And these are basically chemicals in certain foods, particularly fried foods, red meat, eggs, certain cheeses that have been really well shown to worsen other systemic diseases like diabetes and heart diseases and others. But these AGEs are also, it's a great name, right? Great acronym. AGEs are also deposited in the skin, and they induce free radicals. And free radicals can bounce around and cause real damage to the outer layer of the skin, as well as the middle layer of skin, the dermis. For that reason, some studies are starting to look into what we can do from a dietary and from a skin care standpoint to help reduce the damage of the AGEs. One study has shown that if you just restrict calories, it may improve overall health and longevity. And it may also potentially improve the skin appearance as well. So when I was at Stanford, this was a really hot topic because this study in mice came out that mice who did not eat as much as other mice lived longer. And I was having this chat with one of my colleagues named Howard Chang, who's just a genius and a basic science researcher. And I said, Howard, should we all be starving ourselves? I mean, what do you think? And he said, well, Tyler, if you really read the study, unfortunately, you'll find out that the mice lived longer that did not intake many calories, that the starved mice lived longer because many of them committed suicide, and they were compared to the mice who ate a lot and died of heart disease. So it's heartbreaking for the mice, but it's also worth remembering that we don't want to starve ourselves because this can induce depression and all sorts of diseases. The point
Did
is,
the mice really commit suicide?
yes, isn't that terrible? They just gave up living, Ming. It was the saddest. This is terribly sad. And so my point in that story is, it's humorous, but it's also, the real critical point is that we need to just be healthy. So obesity is certainly associated with aging. It's associated with inflammation. It's associated with these ages that I'm mentioning. But a healthy diet, diets rich in fruits and vegetables, is really has the most evidence that it's good for the skin. Fruits and vegetables are enriched with antioxidants, which are natural substances that can help kind of scavenge up so-called free radicals that things like those ages can induce. So bottom line with diet is moderation is key. I did mention a couple of weeks ago that certain types of foods, particularly foods rich in sugar, can exacerbate certain skin conditions like acne and rosacea. So patients suffering from those can sometimes see some improvement with their diet. But most folks who have a healthy, well-balanced diet do relatively well from this standpoint. But stay tuned, because I think nutrition and aging is really a fascinating topic. Another sector within extrinsic aging is exposure to smoke and alcohol consumption. So, all fun things in life, I guess, come with a price. And it's certainly true with smoking and with alcohol consumption. Smoking has really been, correlated in multiple really great studies with the way our skin appearance appears over time. There's this really cool study that one of my colleagues here in Austin performed, where he and his group went to the National Twin Convention in Ohio, where identical twins, thousands of them convene every year. And they took photos of identical twins who had different lifestyle factors. So the photos of twins where one twin had smoked and the other hadn't are dramatic. They do not look identical at all. And in fact, there was something like an average perceived age difference between identical twins, one smoking and one not smoking, of something like 15 years. The reason that happens is that smoking, nicotine in smoke, constricts the blood vessels and reduces nutrient flow to the skin. So that affects everything. When I do skin cancer surgery, for example, I can't do a big reconstruction oftentimes in smokers simply because they don't heal as well due to a lack of perfusion or blood flow in their skin. Additionally, there's something like 4,000 chemicals in tobacco smoke that can damage collagen and elastin, which are the fibers in the skin that give it strength and elasticity. So skin begins to sag and wrinkle prematurely because of smoking. So incredibly difficult to quit smoking. There are so many health benefits for quitting smoking, though, and improved skin appearance and aging is absolutely one of them. Alcohol consumption has also been associated with aging as well. The correlation is not quite as strong, but it's still pretty good. We know that alcohol consumption increases inflammation in the skin and in the body in general, which can cause a whole host of problems. There's this kind of new hot topic called inflammaging, which is the concept that we just generally get more inflammatory cells, more inflammatory activation in our bodies as we get older. And this may contribute to heart disease, to dementia, to diabetes. And now there's even a thought that this inflammaging may contribute to skin aging. And alcohol certainly worsens inflammation in the skin. And additionally, it can cause liver damage, which can increase abnormal blood vessels and abnormal flushing in the skin and redness. So I've certainly had patients who have had liver transplants or have had other liver problems due to alcohol or other causes where their skin is significantly more aged just for that exact reason. And then finally, kind of happier topics are the effects of exercise and the effects of sleep on skin aging. And kind of like nutrition, these are relatively new fields of study, but I think there's some really exciting research going on. After we exercise, we feel great. It's good for us, and it releases endorphins, which can be really make us feel really good. And additionally, it increases blood flow to the skin. By increasing blood flow, we increase nutrient delivery, so kind of the opposite of what's happening in smoking, and that can improve the skin's appearance as well. And although exercise causes acute inflammation, it changes the way our genes produce to actually give an anti-inflammatory effect in the long term. So kind of the opposite of what we see with alcohol. Sleeping is really important with aging and skin appearance as well. It hasn't been incredibly well characterized from a molecular standpoint, but we all know we look terrible after a bad night's sleep. When our kids are up screaming all night, I am not looking my best. And that's due to of factors, we think, but it tends to really appear around the eyes and give us hollow circles and sallow skin. And a lot of times, a lack of sleep is also associated with dehydration. So when we don't have enough hydration in our body and in our skin, it gets really crepey and dull looking. So if you do go through a streak where you're not sleeping well, it's important to really pump fluids. So those are the main sort of extrinsic factors that we see, starting with UV and kind of coming all the way down the list. And just as you made that great point, Ming, these are all things that we can work on and actually do ourselves a great benefit just by changing lifestyle factors and using just basic skincare.
Thank you for that, Dr. Hollmig. And a few follow-up questions with regards to alcohol consumption. There's talk about red wine, how it has resveratrol that helps to maybe improve our health. How does that figure in? What is the balance there between alcohol versus red wine?
I mean, that's a fabulous question, because during the time of coronavirus, I am definitely enjoying a glass of red wine and frankly feeling like I need one at the end of some of these days of work plus homeschool. And I know my wife feels the same way. The data on things like red wine and also coffee seem to go back and forth and back and forth. We'll read articles that they're great for us and then read articles that maybe they're not so good for us. I'll tell you, red wine isn't a panacea. It's not going to keep us looking youthful forever. And the data on some of the molecule you mentioned and others, tend to work kind of in vitro in a test tube. They can help reduce signs of potential aging, but the studies on in real life are not as good. I will tell you that having a glass of red wine, having a cup of coffee are not going to be bad for your skin. I don't know that they're going to make your skin look radiant and beautiful either, but they have not, moderation has not been shown to be associated with really any systemic diseases, and certainly has not been shown to accelerate the rate of skin aging.
And when it comes to exercise, then what kinds of exercise would you recommend? Does it have to be, heart rate above a certain degree, or is moderate exercise okay?
Yeah, I think that, most studies with exercise would show that prolonged, moderate physical activity is important for heart health. I mean, that's kind of what has been studied, and rightly so. Heart disease is the #1 cause of death in our country. So we think that sort of that sustained activity is best. But there's also some studies recently that have shown kind of interval high intensity, like HIIT type workouts are really great for our body as well, and work through different mechanisms. I think the important thing is just consistency. That I advise my patients at least 3 to 4 times a week to exercise to elevate the heart rate, and that's good for the body. It's good for the soul, and it's certainly good for the skin as well.
Wonderful. And Dr. Hollmig, now let's talk a bit about the intrinsic factors then, in terms of proven customer base. Our goal is to really be an inclusive brand that serves different segments of the population, based on different gene expressions and different environments and different backgrounds. Could you talk a bit about how the intrinsic factors, our gene expression, affects our aging?
Of course. I love this topic. I think intrinsic aging is really, really exciting and really interesting because it has so many implications across our entire body. The skin is such an amazing model to study. You can tell I'm getting excited right now. The skin's so amazing because you can see it. We can see how it changes over time. We can see it grow cancer. We can't do that inside our body. So the skin is really, really fun to study because it elucidates, it's kind of a window to everything else. Okay, I hear two questions there, and they're both great questions. The first is, kind of how does intrinsic aging work? What changes are we seeing? Well, science of intrinsic aging is advancing incredibly rapidly right now. There was a great study out of Harvard that was published a couple of years ago that followed women from their 20s all the way through their 70s and looked at the genetics of the skin and identified changes in gene expression over time. So as we get older, the genes that make our skin change. So that's really cool because that for the first time gave us potential targets that we could hit therapeutically. So our group at Stanford followed that and actually showed that a device that we use in my clinic here in Austin can actually make the skin look great, but also hit some of those targets genetically and make the skin younger and healthier. And there's also evidence that care products like retinols and other ingredients, actually many of which are in proven products, can help change the genes in the skin as well. So my hope is that right now we focus on beauty, and with beauty we focus on skin health. My hope is that as we understand skin genetic health and intrinsic aging more and more in coming years, that we'll start really truly focusing on these genetic changes that can drive cancer development, that reduce collagen production, that cause melanocytes to overproduce melanin and change skin tone, that we can really hit those both with our topical products and also with our lasers and other aesthetic devices that we use. So intrinsic aging, really cool, good stuff going on there, and I'm really focused on that. It's a main area of my research. The other question was a great one, and that is, how do different folks of different genetic backgrounds age differently? So that totally ties into this topic of intrinsic genetic aging. And that is it's a neat topic. It's one that has not been that well studied. I'll tell you what's out there. We all know that folks with different genetic, with great genes look young forever and not as good genes don't. So I am this pale white guy, and I feel like I am I am aging because my skin does not do as well with producing collagen and does not do as well with a lifetime exposure of UV light, even though I'm obsessed with sun protection. So in Caucasian skin, for example, we genetically have thinner skin and typically experience wrinkles, loss of elasticity, and also reduced lip volume. That's one thing I'm not suffering from, but everything else that I mentioned occurs over time. Now, other folks, for example, patients of East Asian, I have lots of Asian patients. And I'm not just saying this because I love you, Ming, but I think Asian skin is the most beautiful skin in the world. But it has different changes as it ages. So patients of East Asian descent, for example, have a higher likelihood of experiencing hyperpigmentation because there is a higher density of melanocytes. But wrinkles don't form nearly as early in the aging process. Patients of Hispanic descent are similar, fewer wrinkles earlier in the aging process, but some increased propensity to develop things like seborrheic keratoses, which are these kind of benign, warty skin growths that can pop up on the skin. And then African American skin, even to a greater extent, stands the test of time. Can be prone to changes in color, certainly, but has a higher density of collagen in the dermis and does better over decades. And additionally, many of my African American patients maintain their bone structure better than folks like over time. So there are definitely key characteristics in ethnic skin with aging, but also, and you and I have had many conversations about this, there are key genetic influences on other factors that we think about in the skin too, like development of acne, rosacea, different pigmentary concerns, eczema, psoriasis. All of that ties into this. So while we all have a lot more in common than we do otherwise, there are certainly genetic implications of our backgrounds that play a role in how we age.
Thank you so much for that, Dr. Holmig. And you touched a bit on the treatments that you're providing to your patients, which really sounds really cutting edge. And a reminder to everyone, Dr. Holmig can be found at shelteredskin.com and on his Instagram at shelteredskin. So please feel free to check out all the services and great knowledge that he's sharing with his clientele. So Dr. Hollmig, could you share a bit about the different treatment options that are available and, for which population you would recommend some of these cutting edge treatments?
Oh, absolutely. I think that the foundation of all this is really skincare. And then from skincare, we kind of roll our way into things that are, may be able to do a little bit more, but typically need to be handled by someone like me, like a board certified dermatologist. So, with skincare, in aging, I think the most critical thing that patients can do is to protect themselves from UV light. So having a broad spectrum SPF of 30 or higher, and I really think 30 is the sweet spot, is the most important thing, because as mentioned earlier, that UVA light and even potentially blue light from our devices can really age the skin. So having broad spectrum sun protection, really important. And I know that is incorporated in Proven's kind of core products. Additionally, a good moisturizer is really important as well. As we age, our skin's ability to hydrate us, our skin's ability to trap water in the skin worsens. We produce fewer fats in our skin, good fats, ceramides, and having a moisturizer with those ingredients, and I know Proven has ceramide, which is probably the best out there, and other ingredients as well, really help with moisturizing the skin, which helps reduce dryness and irritation, and those things can lead to dry, cracked skin and fine lines. So UV protection, moisturization, and then we kind of get into sort of the finer points of the game with skincare. One thing that's important is having a good cleanser to remove pollution. I talked a little bit earlier about free radicals when we were talking about nutrition, and pollution can induce free radicals on the skin. So removing pollution, removing dirt and grime after we exercise from the skin with a good cleanser, I would say that's pretty core also. Other things. Well, many folks start to have a lack of collagen growth as they get older. So using something like a retinol can be really helpful. And there are other organic products and ingredients that have been shown to work similarly. I like acids. I love azelaic acid for skin appearance, for reducing sun damage. It's been shown to inhibit tyrosinase activity, which is the rate limiting step when melanocytes make pigment in the skin. That's tyrosinase. Retinols can help slow that enzyme down as well, but azelaic acid is great. Mandelic acid, more and more evidence comes out speaking of the virtues of mandelic acid. And there are so many other ingredients that can be really, really helpful in our skincare. So I would say core is sun protection, moisturization, and also having some sort of a cleanser to reduce the external damage to our skin. And then on top of that, that's where Ming and I, Ming, we often talk about personalized care, and those other ingredients can really hit targets on an individual level. And many skincare products don't contain those. And then after we start with skincare, kind of what I view as the core, we can do other things that have been shown and studied now to reduce aging. I talked about Botox earlier, and Botox can sometimes have sort of a bad rap because it can be overused and give sort of the frozen Nicole Kidman on a bad day sort of appearance. I don't like Botox to freeze faces. I do like to use light Botox to reduce the muscular activity of the face. I like my patients to be able to speak normally and animate their face and express themselves, but not to be able to scrunch down so tightly. Like if you're just reading and squinting, reading on your computer screen, a lot of us squint and don't realize it. And over time, that wrinkles the skin. So a little light Botox has been shown to reduce those wrinkles over an entire lifetime. So we often start that in the late 20s. Other devices that we use in our clinic, and thanks again for the sheltered skin shout out. I think we have a lot of these on our website and some scientific evidence. Many so that we've done research on ourselves that show how great some of these devices are. But other things like using laser therapies to treat sun damage can change the genes in the skin, as I discussed a bit earlier, and make them more youthful. We have evidence that other lasers that we use to treat fine lines actually can reduce the risk of skin cancer and truly accelerate collagen growth. So we use a laser in clinic all the time where we do a combination treatment for sun damage and also for fine lines. It also treats acne scars well too, and surgical scars. We do a combination treatment where we can hit skin tone and texture, and we love it, and our patients love it because they look so good. But we also know that it's actually making their skin significantly healthier and more like their younger self. So that's a whole nother topic for discussion and another one of my favorites. But starting with the core skincare and then heading into things like medicines that we inject, all the way through lasers and other devices can now be used with real good scientific backing. I would warn folks who are watching or listening that there are a lot of charlatans out there, and there's a lot of snake oil being sold out there. There are a lot of spas that use lasers and other devices, and not to say anything against those, but I see complications from spa treatments, particularly with lasers and fillers and Botox, where there is not a physician who is trained in dermatology or plastic surgery sort of leading the way and leading training. Because in certain states, and I'm in one of them here in Texas, you actually don't really need much, if any, certification to fire a laser. And so that is really scary to me as a physician because I've seen, unfortunately, some complications due to those sad cases. Although we can typically help with those too in our clinic. So that's kind of how I think about interventions in that respect.
Yeah, and Dr. Hollmig, it sounds like then we should probably schedule a conversation specifically to some of the treatments so that our listening audience can know what to ask for when they do go to a certified dermatologist for their treatments.
Yeah, I mean, I think that's having some your thought about having some help with being guided toward what skincare regimen or what interventions are right for the individual patient is really great. And I know that Proven does a fantastic job of guiding folks, starting initially with that algorithm and then even going significantly more in depth with that with individual advice. And that's what I do in my clinic as well. And I think that, we can all start with that foundation. But as we branch out into more personalized skincare products and personalized treatment, it's important with a reputable skincare brand, a reputable dermatologist, because these things are not without risk on one hand, but on the other hand, the degree of improvement and the degree of reduction in aging that someone can achieve is pretty remarkable when these things are done the right way. So you don't want to just, kind of spin your wheels in place, kind of going down an unfruitful path.
Thank you for that, Dr. Hollmig. And would you mind just reminding everyone sort of some of the need for personalization and some of the benefits of personalizing our skincare and skin treatments?
Sure. So, the question about whether personalization applies to skincare or not it is one that we're hearing more and more. And to me, the answer is, of course. We are in the age of personalized precision medicine. We are seeing that with cancers we treat now, where patients with devastating cancers can have their tumors sequenced in a drug cocktail be delivered that prolongs their life incredibly. We see that with infectious diseases. We saw that with HIV, where using multiple different drugs in the form of a so-called cocktail can now make patients with HIV, give them the opportunity to live just as long as patients without HIV. Amazing stuff. We're seeing that with the COVID crisis, where we're identifying genetic signatures of that virus and designing drugs to hit those. So to me, personalization also clearly holds true in the skin. Everyone's different. We had a really nice discussion, I hope, today about the genetic differences and even some differences in our exposures environmentally, and how those things affect how the skin is made. So it really, and then we also discussed how some of the research we're doing is showing that our interventions in my clinic, like lasers, can actually target those changes that we know drive skin health and skin aging. So to me, this absolutely translates into skincare. Everyone's skin is different for all of those reasons, intrinsic and extrinsic. Some patients on the basic level have oily skin and are prone to acne. Others have really sensitive skin and are prone to rosacea. Others have both. Other folks have melasma, that darkening pigmentary disorder, or other dark spots on their skins. Everyone's different. And that diversity is what makes the world wonderful and beautiful. But that diversity also requires individualized treatments, because just as everyone has their own wonderful attributes, everyone has their own individual things that they'd like to change about themselves or change about their skin as well. And by really being cognizant of what ingredients are available and how we can use those ingredients to really target the individual problems that we all experience, I think that's how we get skincare to the next level.
That's amazing. Thank you so much for that, Dr. Hollmig. If you wouldn't mind, let's talk a bit about sort of on a day-to-day basis, how we should care for our skin. Could you describe to us what an ideal nighttime routine for skincare looks like?
Sure. And this is where I kind of pivot from talking about all of this, complicated, these complex sort of pathways and regimens, and sort of just focus on skincare, where I'm a total minimalist. Truth be told, I think there are way too many skincare products out there. I spend a lot of time talking my patients out of spending a ton of money and using 16 different things on their facial skin. It's tempting to do that just because the popular media, social media, advertising are constantly pushing ingredient after ingredient. It seems like every month a new molecule is publicized as like this miracle. I call it the molecule of the month. It's like this miracle cure. It's incorporated in all the mass-produced cosmetic skincare products, and then everyone buys that and adds that to what we're doing. It's kind of analogous to my elderly patients who will come in with like 34 pills that they're taking every day. And when we are really thoughtful and go through the list, we can often get rid of like half of the pills they're on are worthless and were just added on decades ago. So my point is, with skincare, less is more. I think that at nighttime, or even I would say after a workout or after an exposure that causes sweat, or where you deal with pollution, it's important to use a cleanser, and just a nice basic cleanser to remove sweat, bacteria, sebum, pollution, these sort of things off the skin. Really will do things that are great for us, like reduce our tendency to develop acne and inflammation, and potentially aging as well. After that, I think a really good moisturizer is fabulous. So anything that is relatively bland, that doesn't cause irritation in the skin. And I like my patients to wear as thick of a moisturizer as their skin tolerates. And there is a wide range there. So that's another area that is really helpful with personalization. Some folks have oily skin and can't do very greasy moisturizers. Other folks have really dry skin and need something almost reminding us of Vaseline. And then some people live in different environments that are more or less humid, or have harder or softer water, and all that can play a role as well. But at the end of the day, I do truly feel like everyone needs a good cleanser and then a good moisturizer at night. And I think that, moisturizers can be used all over, certainly the face. Skin is skin. There are subtle differences. But even down on the neck, the backs of the hands, those are all nice areas to moisturize, especially in the age of COVID. Moisturizing the hands is really important. Many of us are seeing our hands get cracked and dry just from washing them so much right now. So that's kind of the cornerstone of my nighttime routine. Now, I think having some additive ingredients that might hit things like a retinol, an azelaic acid, a mandelic acid, something along those lines, if we're trying to target collagen growth or skin tone changes, can also be really beneficial if they're incorporated into those products as well.
Wonderful. And Dr. Hollmig, could you talk a bit about the morning routine too, please?
Yeah, so I think most of us, you want to just kind of get up and get moving. So I think, again, less is more there. So I think that starting with a cleanser, if your skin is oily enough to tolerate a cleanser twice a day, is great. If you can't, if you're not able to do that because your skin is too dry or irritable, even just splashing a little bit of tap water or micellar water can be nice in the morning. And then using a moisturizer combined with an SPF is really enough for most people, and then potentially a little bit of makeup on top of that. I'm all for a makeup-free society. That's what we try to deliver with our lasers and our other treatments in my clinic. But most folks do wear some makeup. But I think starting with a good moisturizer and sunscreen is the cornerstone of a daily routine.
And after starting a new routine, how soon should patients expect to notice a difference?
Well, that's a great. How long should patients expect after starting a new routine before noticing a difference? It kind of depends on what we're trying to do. Many patients have not been consistent with even something like moisturizing, and you see a benefit of moisturizing consistently very early on, because by sealing in our natural moisture in our skin, fine lines reduce significantly. It's like I never have a great example for this, but it's almost like filling a sponge with water. It starts to be more supple and more full immediately. That's fantastic. Okay, when we incorporate something that blocks harmful sunlight rays like UV light from hitting our skin, that takes a little bit more time. I would expect to see changes in improved skin tone over the course of a week or two with good sun protection. You can almost think of that like when you go to the coast and maybe get a little too much sun and get a suntan, it starts to fade. Incorporating a UV product kind of has the same sort of timeline in terms of getting rid of initial dyspigmentation or abnormal uneven coloration from the sun, unlike an even tan. And then the benefits of UV protection accelerate over a lifetime. So this is a lifetime sport. So with UV, you get some early improvement within a matter of weeks, and then long-term lifetime improvement after that. Other things are a little different. If, for example, we're trying to treat aging, we're trying to get our fibroblasts to grow more collagen, that sort of develops over a matter of weeks to months. With my lasers, for example, I can really acutely induce collagen growth. And what I've noticed is that really takes off at about week 5 with a laser. Patients almost go overnight from having kind of that sort of crepey, matted skin to just having soft, supple skin. It just pops. But it takes some time for something like a retinol or other ingredients that can grow collagen to stimulate our DNA to make collagen, for that collagen to be transcribed and then produce and then end up in the skin. It's a little more of a slow roll. So with these things, patients will do best by just committing to it. We treat lots of patients with acne in our division here at UT. And a lot of the times they're younger patients who give up on treatment after, maybe just a month, and will say, hey, my acne got worse on this medication. But truth be told, you have to stick with some of these things. It takes longer. With acne, we typically see pretty dramatic improvement between month 1 and month 2. And that happens with many facets of skin aging as well. So I hope that answers your question. Being, how long it takes to see improvement varies on what we're doing and what we're seeing in the skin.
Great. Thank you so much for that, Dr. Hollmig. Now, sometimes it feels like the day to day of caring for our skin and of, hoping that it gets better and it, ages gracefully with time can feel like a Sisyphean task of effort. Can you share some words of encouragement to our listeners who are, ardently on this journey with us?
Well, eventually the rock rolls down the hill and runs us all right over, Ming. I don't think I don't think that's very helpful or encouraging, though. But the good thing is we can look great while we're pushing the rock. Yeah, I mean, I think that in terms of really describing a way to give hope to all of us, yeah, I mean, things have changed dramatically even since I've been in practice. We can do things now that truly change the way the skin ages and truly reduce the rate at which it ages. And we're in control of those. And it is often so frustrating for patients not to be in control. I'll have patients come in with a big skin cancer and say, oh, I changed my diet because I thought that would help and it didn't. Well, changing your diet's not going to make a skin cancer go away that's already there. We have to surgically remove it. Well, it's not that way with skin health, and it's never too late to start. I think that what I advise patients to do is try to find a simple, consistent way to take good care of their skin. It doesn't have to be difficult. It doesn't have to be incredibly expensive or complicated. But if patients can reduce those extrinsic aging factors, reduce extensive exposure to UV light, cleanse their skin, get rid of things like pollution, try not to smoke, try to drink alcohol only in moderation, exercise, do their best to get a good night's sleep. All of that makes you feel good, and it also helps your skin look really great as we all get older. I think if you ask most people if they'd rather live forever but age on a trajectory where they get really old and really sick and don't look great, or whether they'd like to live until they're, let's say, 95 and look and feel great all the way till the end and then die a peaceful death, most people would want to be in that latter group. And I think that with all we know about extrinsic aging and with the new knowledge we're gaining about molecular pathways with intrinsic aging and the connection between the two, there's real hope that we will get closer and closer to that ideal over time. And I think, frankly, we're already getting there. I've really seen great things even in the last couple of years, and I'm excited about what the future holds.
Thank you so much, Dr. Hollmig. We feel so lucky to have heard this cutting edge talk about aging. Thank you so much for our listeners out there as well. And we will be back with Dr. Hollmig in a couple of weeks regarding the next topic, which we'll share with everyone. Thank you so much. Have a great weekend, everyone.
Thanks, Ving. That was a blast as always.